I'm Janani Venkatesh. I'm project officer at South India AIDS Action Program. We are working to increase access of female sex workers to comprehensive and non-discriminatory healthcare and SRHR. We've converted almost all of our work into online work because we're not able to meet people on the field. But we're also continuing. We're trying to do all the work that we have been doing in the past year and a half by staying connected over the phone. So, for instance, we have been in touch with the district AIDS control and protection units to sort of mobilize for ART medication to be home delivered to sex workers who are HIV positive. To sort of get the whole access to SRHR, it's completely gone down because almost all the focus and attention is on the COVID crisis. But we're trying to ensure that this doesn't disrupt access to services in a very extreme way. So we're trying to stay in touch with sex workers to understand their issues, to sort of assess their needs and what kind of SRH issues they have, what kind of mental health issues they have. And another thing we've done is we have trained our community counselors who've been trained in the AmplifyChange project. We've given them a refresher training on telephone counseling. So that way they're providing counseling services to other sex workers through phone call. Sex workers in general opening up about their sexual and reproductive health is quite a challenge. So the silence and the stigma around SRHR clearly sort of reduces the access of marginalized communities to SRHR services. And the COVID-19 crisis is a clear example of that because there is a lot of discussion about comorbidities like diabetes and asthma and mental health even. But there is still a silence about SRHR except for HIV, of course. So the more and more there is a silence around SRHR, the more and more SRHR isn't being addressed, the issues aren't being addressed, access will keep reducing, especially for the vulnerable, making them more and more vulnerable. The silence around SRHR should be revoked, and more funding should pour in for SRHR beyond HIV.